Hi there. For a while now, experts have been warning about how the pressures of the past few months will place strain on people's mental health and well-being. In this Culture Chat, we're joined by Louise Sharpe from the School of Psychology and Tessie Phan from the Safety, Health and Wellbeing team to hear what they're doing to support mental health and well-being.
Tessie, what's the university's Safety, Health and Wellbeing service seen during the pandemic? Do you think that people have been treating their own mental health differently or that of their team?
Working remotely because the pandemic has had such a wide-ranging impact on our staff. Some have really thrived being able to work more flexible hours and not battling the commute to and from campus, whereas others have really suffered because of the abrupt loss of social connections, the prolonged isolation, reduced physical activity, and the blurring of that work and home environment. But we've seen a real hunger for information. We've noticed how much people are reaching out for advice to help their colleagues. And teams are trying to cope with the next wave of uncertainty, which is around the new ways of working and what resources might be available for us to stay well. We've been closely monitoring the usage of the Employee Assistance Program, and we're really pleased to see that staff here continue to practice help-seeking behaviours. We've noticed that the mindfulness community of practice is really thriving, so wellbeing has certainly been the front of mind of our staff, and there's a more balanced and considered approach to addressing physical and psychological risks. Louise, what do you think will be different about mental health and wellbeing post-pandemic?
Yes, well, it's difficult to know because, of course, we still probably have some mental health impacts to come from the economic issues that people are facing, where they or their families have lost employment and, you know, suffer difficulties going forward. But I think there is reason to be optimistic. One of the things that I've noticed is that there's been a lot of initiatives to try and support people during the pandemic. And certainly there's been an opportunity to work from home. Now, that's been difficult over the past 3 months for many people, those with children who have to do homeschooling or who have had extra work to try and get courses online and so forth. But it really gives us an opportunity, I think, to think about the ways in which that has worked for some people and how we could use flexible working to support our staff to work in a way that actually is better for their own well-being going forward. What do you think will happen in the future in your area, Tessie?
I agree. We have a real opportunity here to implement principles that can reshape work to enable us to be well at work. I think some of the ingredients needed for this are displaying behaviours which will encourage each other to try different things, to share what worked and what really didn't work. Perhaps practicing team rituals that will help us stay connected, give us that sense of belonging, trust, and purpose, whether we're working on campus or working remotely. And recognising that we're all on this continuum of wellness and it's really fluid. No matter whether we're thriving or not so well, there's people, activities and resources that can support us. We really want to look at focusing on team resilience and psychological safety.
Interesting thoughts there from Tessie and Louise. It's clear that working flexibly will have both positive and negative effects on our mental health and well-being. All the more important then that we learn the right lessons from our pandemic experience.